So another great reason to be able to test people for an exposure is not only can they get back to work, however, in addition to that, I mean, we are able to then take your plasma, your blood, spin it and get the plasma and give it to somebody else. And they have shown really amazing data on being able to get people who are really sick on the vent, off the vent, and home by using plasma antibodies.
Don't forget to smash that share button, subscribe to my page, follow me on Instagram @LanceBachman, and keep sending me those questions. Happy Easter, everybody, from the den. I hope you're enjoying your family and loved ones. I'm excited to have Dr. Shiloh and Dr. Luciano back here on Easter Day to give us an update about what's going on in the community. Doctors, can you please give us an update of what's going on in Bucks County and Philadelphia area right now, what you're seeing since last Sunday? Dr. Luciano, you first.
Sure. I think, in Bucks County area, we have a little over 1,000 cases, around 30 deaths, so about a 3% rate. So things we expect this week are going to be hitting its peak, and it will peak in different areas at different times. So hospitals are preparing for that. Fortunately, things seem to be flattening in New York. So hopefully that will translate soon to us, and then we'll be able to predict what will happen down the road from there.
Dr. Shiloh, can you tell us what's been happening in Bucks County, Philadelphia? What you're seeing?
Yeah, I mean, I think at least in Bucks County, the data shows that we have been flattening the curve a bit. The numbers of new cases is actually going down for the last couple of days. That's actually good news. Obviously that doesn't mean we should take our foot off the pedal, but it does suggest that what the actions that we've taken are working, and we have to keep the course, stay the course, and hopefully people will continue to improve. So yeah, Bucks County's going down. Philadelphia's getting ready. Temple has a new, the I-Core Center that they opened up. It will be open tomorrow to potentially house a lot of patients when the expected surge happens in the next 10 days.
So I've been PM'd every week, and then about your show and about what you're talking about. People love the information, so I appreciate it. I know it's Easter Sunday, so I'm going to try and make it quick. Here's my question to you. People keep asking me, saying, I'm more confused, Lance. I'm more confused. Not by used to, by watching the news, whether it be MSNBC, CNN, or Fox News. Even I'm more confused. Like, are more people dying or less people dying? I see people being out on the street now more than ever. The Italian market was packed the other day when I was FaceTiming someone. Can you tell me why are people so confused right now? Dr. Shiloh, why are people so confused?
Well, it's a shame that they're confused. I think there is a bit of misinformation that gets out there, and so much information that people don't exactly know who or what to believe. The reality is that the guidelines remain the same, which is that we're supposed to remain sheltered at home unless we have to go out for the most important things like going to the market or going to the pharmacy, which we should be doing as infrequently as possible. We should be social distancing, and we should be wearing masks when we're out. And that's another critical point, is that, we do see that people are still not adhering to those rules. The more we adhere to them, the more likely it is to continue the trend down in the number of new cases. And so that's what I would continue to advise.
Dr. Luciano, here's my question to you. We were talking earlier, and, you know how I feel. I'm petrified to be on a ventilator. I have 4 kids. I mean, Dr. Shiloh, you know my wishes. I've asked you multiple times now. You're one of my good friends. Dr. Luciano, here's a question for you. What's the average time on a vent, and what people are making it once they are on the vent? So I'm hearing some disturbing numbers.
Yeah, it is disturbing, so it's about 1 out of 5 will come off event. I think 20%. The length of stay, typically ICU, I think averages around 20 days. So it's a long course. The nature of this virus is that it replicates and it causes havoc to the system as it tries to fight itself off. So the body's reacting towards itself, the lungs are affected, and sometimes respiratory compromise happens quick. So ventilation, is life-saving, but sometimes in this scenario, patients can't come off, and they're, they compromise from that.
I mean, that's really scary to think how long you'll be on it, and your family and loved ones can't even be with you when you wake up. I mean, this is
terrible.
So, Dr. Shiloh, we were talking, and a lot of people are hearing different things about antibody tests, buy them online, plasma, all these different things. Can you tell the viewers what it actually is and how it works, Dr. Shiloh, please?
Surely. Well, obviously, when you get exposed to any virus and bacteria, your body mounts an immune response. It's very complicated. But to simplify it, eventually you develop antibodies which work against the virus. There are two main types, IgM and IgG. IgM comes early, IgG comes late. So what we were talking about a bit earlier is that one of the ways that people are discussing to get the economy back moving forward, which is something we all want as well as the well-being of people, is to test people with what's called a lateral flow assay, which is like a pregnancy test ostensibly. And what will hopefully come out soon is the ability to prick your finger, put a little bit of blood on a little circle, and then the thing will slide along, and then you'll have lines that show whether or not you've been exposed to the virus. So many of us feel we may have been sick at some point in time. We don't have a positive COVID test, but do we have the antibodies? If we do, well, the best that we can tell, that at least gives you immunity to some degree. Yes, there's reports that there are maybe reinfections or other things that can come up, but to the best of our knowledge, it does give some immunity and would allow people to go back to work. So hopefully that'll be out soon.
So here's another stat that I've been asked about 4 or 5 times over the last 2 days. On a percentage basis, people getting the virus seems a lot less people are actually being admitted to hospitals and going on to the ICU and a ventilator. Dr. Luciano, do you have any reason why that could be, why we're seeing a less, which I think is good news, intake where, hey, I got the virus, but I don't have to be ventilated or go into the ICU?
Yeah, so I think a lot of factors there. I think the social distancing is absolutely working. The less exposure to a virus in the community is huge, and the less exposure to the amount of virus. So if you get a large dose of the virus in close contact with someone, that can mean a worse prognosis and getting little exposures here and there. I also think that the potential therapeutics that we're using in the beginning stages of the hospital, like hydroxychloroquine, which is a big one that a lot of hospitals are using right off the bat, to stop that whole inflammatory response that attacks the system. So that might be an early player to this that affects the ICU as well as the ventilation.
You know, it's funny because, and Dr. Shiloh says this, I consider we're in a war right now. This is a war. And you don't always have the information about who's over the hill to go take it. We probably wouldn't have won wars if we had to know every piece before we made a decision. Is hydrocodone, the hydro drug, I can't pronounce it correctly because of my, I can't pronounce it correctly, but is it working, Dr. Shiloh? And from what doctors are saying, I know we don't have the data, but from what doctors are saying, is it working?
Well, yeah, I mean, it looks like there are situations in which it's working. The American Association of Infectious Disease Doctors does recommend utilizing it in a hospital, particularly if it can be on a clinical trial. One other thing that I wanted to mention when you asked me about the antibodies, one thing that has actually some good data behind it now, it came out in the New England Journal of Medicine, in fact, is the plasma antibodies. So another great reason to be able to test people for an exposure is not only can they get back to work, however, in addition to that, I mean, we are able to then take your plasma, your blood, spin it and get the plasma and give it to somebody else. And they have shown really amazing data on being able to get people who are really sick on the vent, off the vent, and home by using plasma antibodies. So yeah, I mean, is that you can use Plaquenil, which is the trade name for the hydrochloroquine. We are using it, and hopefully that helps keep people off the vent. But those who get on the vent, for those people, I think the IV antibodies, the plasma is going to be the drug or the treatment of choice going forward.
Dr. Luciano, do you feel like the drug's working from what the doctors are telling you? I know there's no data behind it, and nobody really wants to be. I know it's controversial, so people are taking 2 different sides, which I don't blame people, right? But from what you're hearing from your fellow peers, what are you hearing?
Well, I mean, I think it does work in certain scenarios, so sometimes you just gotta call an audible. We don't have all the evidence. You just gotta use what you got. Meaning that you're gonna save someone's life or not. Throwing things at it that may work sometimes is all you can do. So there are some promising results. There's a lot of other therapeutics, antivirals. So you mentioned the plasma. There's studies with zinc, to help with the hydroxychloroquine response, and azithromycin with it as well. So there's a lot going on right now. This is not like we're waiting to see if this works. This is being done in real time. So the question is, how are we going to apply this to large-scale population? But I mean, this is on the front lines being used, and hopefully it is affecting the numbers, and we can have some more data down the road. But hopefully these are promising numbers.
Doctor, you said something interesting, and Dr. Shiloh, I'm going to let you answer this question first. The governor of Texas, and we're not talking politics, everybody knows that, so let's just keep it to your professional opinion because I respect you both as doctors. And I'm going to listen to you like I always have when you guys tell me something. I recommend everyone watching this. You have two of the brightest people in the Bucks County, Philadelphia area here. They don't have the best of intentions. The governor is going to reopen Texas. Do you think he's making the right move? Yes or no, Dr. Shiloh?
Well, in my personal opinion, I would say no. I think that until we have that antibody testing we were discussing, we really have no idea about what the numbers really are as far as herd immunity. In order to get to herd immunity, the studies suggest you need about 70% of the population to be immune. And as I was mentioning to you earlier, in a small study out of Germany, they studied 1,000 people. There was an outbreak in that town in early March. And of the 1,000 people, only 14% actually had the antibodies to the virus. What does that tell you? That tells you that even in a town that had a heavy early viral infection, there's only 14% of the people. You need to get to 70 to have herd immunity. So, again, this is a situation where I know people want to get the economy going, and I understand that, and I know it's important, but to what cost? And I think until we know and can test people, I think it's a little too early to do that. That's my opinion.
Dr. Luciano, your opinion?
Yeah, I think, it can be misleading when you have low numbers in your state. It's just a matter of time. I mean, this is a country. We're all connected here. It's not an individual country. So to think that you're different than other states is, I think, it's not the right approach because those people can cross state borders. You get some infected people there. They have an exponential growth. They affect the whole country. So it's important to have a united response to this. And, knowing that what's going to happen next couple of weeks, hopefully it plays out where we do have this more focused approach to testing who's okay in the community, who's not, to make sure that we got this under control so we don't have a huge outbreak. The numbers right now seem to be lower than expected, which is a great thing. That means what we're doing is working. So I think it's really important to be patient in the next couple of weeks. But, in my opinion, I think it's a mistake.
And I'll never talk politics, but I actually agree with you too. I know everybody wants the economy to come back as fast as it can. And I do. I'm a businessman. I mean, obviously, I want it to come back as fast as anybody. But 1 death, 2 deaths is just too many at this point. If we're making irrational decisions, I'm not saying he is or not. I actually agree with you. Get the antibody test that Dr. Shah was talking about, and I think if we get them in the masses, which we are a great country, we probably can reduce them at a relatively quick time, and then make decisions from there. So, but this is the other question that somebody asked me. I thought it was probably one of the best questions. Say they do open May 1st, right? Which it looks like that's going to be the date that we're going to open back up. I don't see them extending it, even myself at this point, with things flattening out. I think they're going to open things back up. Are we all supposed to go back to life as usual? No big deal. The coronavirus is gone now. Is that what's expected, Dr. Shiloh?
Well, I mean, the virus will not actually be gone. I do believe that what will happen, or what we need to do, is to continue to protect the most vulnerable people in our society. So I would tell you that, I have parents that are 75. I'm not going to be telling them to go running around and going to restaurants as much as they want to go, as much as they would like to go. I think people still need to look at individual cases and say, hey, should I be going out? Or, maybe people still need to wear masks if they go out, just to be careful. I don't think that it's going to go back immediately to life as it once was. We know the schools have already closed down for the rest of the year. So I think that, it's going to not necessarily be life as it once was, not for a long while, not until either we have herd immunity or unless we have a vaccine.
Dr. Luciano?
Yeah, so I think that this is going to be with us for some time. It's going to come in waves. So as things open up, we'll get more exposure, and it's all about mitigating that response. So until a vaccine, and some more therapeutics are concrete, then this is going to be a little thing that we change the way we interact with others. So just being aware of my actions affect you, handshaking, close contact. It's just good hygiene, and just being aware of how this thing happens, how it spreads. How we can kind of toe that line.
Well, doctors, thank you for being on the Den today. Happy Easter, everybody. You heard from Dr. Luciano, Dr. Shiloh, Philadelphia's 2 top doctors in our area. We're fortunate to have them. The digital line is out. Happy Easter, everybody. Stay safe.
We're doing a good job. I know it's tough. It is very challenging. It's challenging for me personally. It's challenging for all of us. But I do believe that we are doing a good job of staying home, of avoiding the kind of behaviors that can cause the virus to continue to spread. And we have to continue this until we flatten this down even further, until we see the curve coming back down, or the slope coming down. And then once we are back out and allowed, so to speak, to go back to normal, we really still have to follow some really basic hygiene issues, as well as taking care of different individuals in a different way. So yeah, then let's just keep it up and, keep up the hard work. It is hard work, and let's hope that this is, getting better and we can continue to improve as time goes on.
Yeah, so I mean, it's optimism. Things seem to be going in the right direction, but being aware of why that is, so we can make sure that we continue with that, and also to reach out to others if you're feeling down, depressed. A lot of people are feeling bad symptoms because of this lockdown. So reach out to somebody, reach out to your provider, take care of your health, and just know that things are going to get better pretty soon. So just take care of yourself.